Module 3, Personnel Management and Competency Assessment. Personnel, qualifications, competency programs, and training documentation. In this module, what you'll learn is how to develop and implement competency assessment programs, manage and document training and continuing education, and ensure personnel qualifications that align with CLIA requirements. So what are the personnel qualifications under CLIA? Categories include testing personnel. These are who conduct the laboratory test and report results. General supervisor. They oversee the testing personnel and ensure compliance with SOPs. Technical consultant or director, actually that should be supervisor. They provide technical expertise with test methodologies. And then laboratory director. They're responsible for overall operations and compliance. There are different requirements for moderate testing, moderate complexity and high complexity testing when it comes to personnel. Moderate complexity testing often requires a high school diploma with training for the test performed. And it might require additional education for supervisor roles. For high complexity testing, there's a minimum associate degree in laboratory science or equivalent, and advanced degrees or certifications required for supervisory or director roles. So as it's implied, high complexity requires more science, more thought process, more knowledge, and therefore a higher degree training. Typically, a bachelor's degree is required, but some instances an associate degree with certain qualifications can be applicable. So the education and experience standards for testing personnel, broken down by high complexity. They require a bachelor's degree in chemical, physical, biological, or clinical sciences, or an associate's degree with proper laboratory training and experience. Moderate complexity testing require an associate's degree in laboratory science or medical laboratory technology, or a high school diploma with documented training and experience in the testing form. Wave testing, which is the very minimum, requires no formal education, but must follow manufacturer's instructions for testing. So you need to have training to perform wave testing. If you remember, wave testing is typically strip testing, either glucose strip testing or like a urine dipstick. Something like that. Colorimetric test, very simple. Doesn't require a lot of complex analysis. Then for general supervisor, under high complex testing, they require a bachelor's degree in chemical, physical, biological, clinical, laboratory science, and 1 year of training or experience. Or if they have an associate's degree, then 2 years of lab experience. For moderate testing, it's equivalent to the testing personnel requirements, which is the associate's degree in laboratory science or a high school diploma with documented training experience. So obviously, moderate complexity is a lot less extensive compared to high complexity. Moderate complexity often is an FDA-approved test. Oftentimes, maybe screening instrument like an AU. Some clinical analyzers, I think, hematology analyzer is a moderate complexity test. So anything that's you just load on the instrument and the instrument does everything and it kind of just gives a readout of positive or negative. That's moderate complexity. The technical supervisor or consultant in a high complexity setting, the MD, DO, or DMP, or a master's degree in physical, chemical, biological, or clinical science with 1 year of lab experience, or a bachelor's degree with 2 years of lab experience. So as you see, education can replace a year experience, or a year experience can replace a lack of education. The moderate complexity is equivalent to the high complexity requirements for technical supervisor and technical consultant. So CLIA doesn't differentiate for moderate and high complexity when it comes to being a supervisor. So as you move up the ranks, as you move up the degrees of the chain, the hierarchy, there are more and more requirements. For clinical consultant. So I didn't really go over clinical consultant, but that's basically almost equivalent to a doctor practice in your practice. So it's the same for all complexities, requires an MD, DO, or DMP license. So basically they have to be a doctor to be a clinical consultant, because they're typically doing consulting when it comes to specifically in the clinic sciences. Usually it's interpretation of testing, things of that nature. So usually it's actually it has to be a licensed doctor, which could technically a licensed doctor can be a laboratory director. And for laboratory director, for high complexity, and moderate complexity, I don't know what happened here. Moderate complexity, bachelor's degree, chemical physical science with 1 year of laboratory training for moderate complexity. But in high complexity, you have to either be an MD or have a PhD in chemical, physical, biological science. And sometimes there's additional board certification or experience that may be required. Actually, there is board certification for high complexity. It's supposed to be for moderate or high complexity. So you need to have board certification. As a PhD, you must have a board certification as well. Some additional considerations. Ongoing training, competency assessment, continuing education are required to maintain qualifications in compliance with CLIA. Personnel must meet state licensures when applicable. This structure ensures that laboratories maintain a skilled and qualified workforce capable of producing accurate and reliable test results. And other ongoing responsibilities include ensuring the credentials are met for CLIA standards, and of course, always maintain documentation for audits and inspections. So what is competency assessment? It's a systematic evaluation to confirm laboratory personnel are capable of performing the testing accurately and reliable, understand and follow laboratory protocols, identify and correct errors effectively, allowing for smooth functioning of the laboratory. So why is competency assessment important? It ensures quality and consistency in lab results. It confirms that the lab meets CLIA requirements for personnel performance evaluation. And it builds confidence in lab staff and management. Some key elements of competency assessment include direct observation, where you evaluate the technique and adherence of procedures. So you evaluate the technician's technique as well as their ability to follow the procedures. Monitoring test results, review QC results, purposes of testing and error logs, and problem-solving skills to test understanding and troubleshooting scenarios. And lastly, knowledge assessment. Conduct quizzes or discussions about SOPs and regulations. So how frequently should competency assessments be performed? An initial assessment should be performed during onboarding, and then at 6 months after the initial assessment, and at least annually thereafter. Of course, additional assessments may be performed if issues arise or if procedures change. So initial assessment must be performed during onboarding, but anytime there are new testing updated, then you need to be able to be competent in those test systems. So if your lab was only testing, say, blood clinical chemistry, and then they turn on molecular, then you must show that you have an initial assessment competency to do patient testing with that new testing system. Competency assessments are a continuous process essential for ensuring lab staff maintain their skills and adapt to changes in laboratory practices, new technology, or updated procedures. CLIA regulations mandate that labs conduct competency assessment at least annually for all testing personnel. And regular evaluations help identify knowledge and skill gaps early, providing opportunities for retraining or corrective actions before errors occur. So one of the things about CLIA is they like to encourage identifying issues before they impact patient testing, before there needs to be corrective actions. So being proactive, competency allows you to be proactive in evaluating these